New research is pointing to millions of women around the world who are having unnecessary and potentially harmful cesarean sections. But according to one health expert, despite an increased demand for C-sections in Jamaica, the resources are not available to facilitate that procedure unless it is necessary. TVJ Shamela Pullen tells us more in this evening's health report.
The research published in the Lancet Medical Journal found that global rates of cesarean sections have almost doubled between 2000 and 2015. The study also found that many of these surgeries are being performed without any significant maternal or birth-related benefits. There is also the view that some doctors are pushing for women to do cesarean sections because it means more money for them. But according to consultant gynecologist Dr. Kathy Madan, that is not the case in Jamaica.
Some mothers request C-sections, and there's actually an indication that is labeled C-section by maternal request. However, it's not well adopted worldwide because, as said before, so many risks are involved that we should all encourage vaginal deliveries if it's feasible. Only after the mother has been educated properly, if she insists thereafter that she's still not willing to do a vaginal delivery, can it be entertained. But locally, we have not adopted that yet.
Cesarean section, also known as C-section or cesarean delivery, is the use of surgery to deliver babies. Dr. Madan says Jamaica is seeing an increase in the number of persons wanting to do C-sections. Currently, 30 to 45% of the deliveries done at major public health facilities are C-sections. But Dr. Madan says the reasons are legitimate.
So we have more women who've had, say, one previous C-section who may be candidates for a trial of labor or trying to push the next time around. But because of the risks involved, and because some of our institutions can't facilitate that kind of diligence in watching these patients, they end up having another C-section. We also have patients who've had previous myomectomies or removal of uterine fibroids, and once they've had that, then they must have a C-section.
She also said with an already burdened health sector, Jamaica would not be in a position to facilitate such procedures.
So we have operating theaters that have to be fully equipped for a C-section. We have staff that needs to be paid for cesarean sections, and also some patients in extreme situations may need blood products. And, we have a low incidence of blood donation.
With your health report, I'm Shamela Pullen wishing you good health.